Pro tip: if you're dabbling on the wrong side of the law and a masked vigilante saunters menacingly into the hallway, take the nearest exit. Today we're analyzing this classic scene from Marvel's Netflix adaptation of Daredevil featuring actor Charlie Cox as Matt Murdock. Though he is trained in law, today's lecture will show that Matt also has a penchant for human anatomy and how to exploit it. Professor Murdock may have forgotten that many of us do not have senses advanced enough to study a fight taking place behind a closed door.
Fire a weapon! There. Through there.
Before it swung shut, it looks like there may have been a powerful front kick to the sternum of one man and a swift right cross to the left orbital region of another, respectively. Enough to knock the wind out and disorient, but not to do lasting damage. Whatever blows Matt administers next, we can assume hold a little more gravitas, since, well, only one of the bad guys makes it out of our 50 square foot battle arena. Looks like the unlucky door crasher is 6 or so inches off the ground and moving with a downwards trajectory when he makes contact with the door. Conceivably then, Matt must have lifted him off the ground and thrown him into the door, which is definitely more favorable than crashing sideways into the concrete floor or hitting his head on the adjacent concrete wall. Okay. Professor, hold on. I'm having difficulty matching your pace, and before we go any further, I wanted to say a few words about your incredible sensory abilities. This scene is actually from the 2003 Daredevil film featuring Ben Affleck, where Matt wakes up in the hospital after the initial chemical accident that blinded him with newly acquired supersensory powers. From what I can gather, it is canon that the chemicals to which he was exposed, apparently some form of radioactive liquid, took his vision but left 4 superhuman senses: tactile, touch, olfactory, smell, auditory, hearing, and gustatory, taste, in its place. And suddenly, Matt can do this.
You're getting stronger. Let's get started.
Later, he explains,
I hear things, coughs and fights, cats meowing, sometimes walks away. I know where things are and when they move.
while radioactive isotope-induced superpower may remain in the realm of science fiction, a study published in 2017 by Dr. Karina M. Bauer et al. Reveals that in the setting of profound ocular blindness, numerous lines of evidence demonstrate the existence of dramatic anatomical and functional changes within the brain.
How are you keeping up with me? You're blind!
Her findings suggest that the brain may have the capacity to rewire itself to interact with the environment optimally using the remaining available senses.
Since I never had eyesight, I never had to train it. So I've trained my other 4 senses to their maximum.
Bauer goes on to explain, these observed changes were widely distributed, implicating areas responsible for the processing of intact sensory modalities, such as touch and hearing. Occipital cortical regions, normally implicated in the processing of visual information, and regions involved in higher order cognitive functions, such as language, memory, and executive functions. For researchers in the world of visual neuroplasticity, like Dr. Lotfi Mirabet of Harvard, this is exciting stuff. If the brain can rewire itself, perhaps through training and enhancing the use of other modalities like hearing and touch and language tasks such as braille reading, there is tremendous potential for the brain to adapt. Some of you may recall Ben Underwood, a young man who was capable of seeing without seeing, able to navigate his surroundings without a guide or cane.
Instead, he sees with sound. He makes a sharp click which bounces back off nearby objects.
Human echolocation, reminiscent of Daredevil, which Ben developed after losing his eyes at age 3. Ben unfortunately passed away after this video aired years ago, but his unique ability suggests that under the right circumstances, our sensory systems have untold potential. This may have been influenced both by a supportive environment at home.
Ben's echolocation is so good that at home his mum, Aquanetta, and brother Isaiah make no allowances for his blindness at all.
As well as by the brain's increased plasticity throughout childhood years, while it is rapidly forming connections based on environmental input. All of that to say, maybe a situation where a blind man snipes a combatant approaching from beyond a wall with a 25 or so pound microwave isn't so far off. The flat bottom of the appliance-turned weapon connects with what appears to be the main portion of the right parietal bone towards the upper back part of the skull, and causes the thug to collapse without exactly bracing his fall. Disoriented, at the very least. These parietal bone plates, one on either side of the head, are quite strong and would be unlikely to fracture here. The soft parietal and occipital lobes of the brain, however, which they are tasked with protecting, will not be so lucky. Undoubtedly, bouncing off the skull at the point of impact and initiating the common coup mechanism associated with a moving object impacting a stationary head. The upper thoracic and cervical spine, as well as the back of the skull belonging to our second patient, crash forcefully into the concrete wall here. This would be like a fall straight onto the upper back from a few feet off the ground maybe. You know, like when your feet slip out from you at the skating rink.
Twist your side and tuck your head.
Oh, wow.
Force enough to cause a concussion via a coup-contra coup mechanism, which also occurs when the moving head and brain strikes a stationary object. It should be noted that depending on the force involved, both the coup and contra coup mechanisms occur nearly simultaneously as the bone bounces around in the cerebrospinal fluid within the skull. Impact like this would likely also take your breath away. Like, literally. Did you know that getting the wind knocked out of you refers to a spasm in the diaphragm, a sudden contracture of the muscle responsible for breathing? Upon inhalation, the diaphragm contracts and flattens, and the chest cavity enlarges. This contraction creates a vacuum, which pulls air into the lungs. Here, Professor Murdoch demonstrates an alternative firearm usage, more in alignment with his strict let 'em live policy. I'm moderately concerned about the facial bones of these men. While these attacks look less impressive than the others we've covered so far, the bones of the face are not exactly built to withstand blows from what amounts to a steel rod in the hands of the Daredevil. Matt introduces the barrel of the firearm to the front of its owner's face.
Oh my God, introduce us.
Putting the lacrimal, nasal, and maxilla bones at risk. If any of these structures were to break, I've got my money on the nasal bone. Colloquially, when people refer to a broken nose, it is either this structure that has fractured or the upper and lower lateral cartilage, which comprises the bridge of the nose. Although cartilage is a strong, flexible connective tissue that protects your joints and bone and typically acts as a shock absorber throughout the body, it can also break. In most areas of the body, broken cartilage does not heal well, leading doctors to develop surgical techniques to stimulate growth. The nose, however, is not most places. Here, cartilage cells from the nasal septum, the part of the nose that separates the nostrils, are known to have great capacity to grow and form new cartilage. There are even some studies in which cells from the nasal septum have been used to graft cartilage defects in other parts of the body. As for our next patient, a fractured orbit, or eye socket, may also have the capacity to heal on its own, depending, of course, on the severity. The orbits are bony structures of the skull that house and protect the eye and supporting tissues, and are composed of the edges of many bone plates that converge there, including the frontal, zygomatic, maxilla, ethmoid, and lacrimal bones, amongst several others. Generally, bones are weaker where they connect to other bones. Still, in some cases, your ophthalmologist may recommend placing ice packs on the area to reduce swelling and allow the eye socket to heal on its own over time. Judging by the way our patient is rolling around though, I don't know if he'll be one so lucky. Another novel firearm application, Professor. Garand Thumb would be happy. And how many bullets have you dodged so far? Obviously, our guest lecturer is interested in keeping the focus of today's video on various physical forces applied to the human body. A swift kick to the abdomen could potentially cause damage to the vital organs and systems that are housed there. The liver, stomach, small and large intestines don't respond positively to blunt abdominal trauma. And even if the skin is unbroken, lasting abdominal pain after the application of such force should be taken seriously. In a 2012 article in the Journal of Sports Physiotherapy, Cassie Barrett, a doctor of physiotherapy, warns her colleagues, who are often on the sideline when sport injuries happen, organs can hemorrhage slowly for days or even weeks before symptoms of systemic dysfunction or organ failure will be displayed. For this reason, all athletes with significant abdominal trauma should have a medical examination even if they have no obvious signs of organ damage. I commend her for her warning. Obviously, had the round from the attacker's pistol connected with Daredevil's midsection, it'd be much worse. But we'll save that for an upcoming firearm injury video.
And just simply rip down the eye. And now you are in control.
Here, Professor Murdoch performs a very smooth judo-inspired disarm before hammering his opponent with the butt of the confiscated weapon.
Detroit Urban Survival Training.
It looks as though Matt is grabbing the barrel of the gun with one hand and possibly his opponent's wrist with the other. Even if applied at an opportune moment, a quick yank downwards on the wrist wouldn't be enough to flip an opponent without exploiting their anatomy perfectly to gain extra leverage in some way. If we back up for a moment, we see our patient's shoulder abducted while the elbow is in flexion, conceivably as he is trying to pull the gun away from Professor Murdoch. From this position, if Matt presses down on the gun, the patient's shoulder is forced into extension, which denotes that the head of the humerus rotates forward inside the glenohumeral joint. This type of extension may be associated with a shoulder dislocation or a humerus fracture, and may look familiar to fight fans to the Brazilian Jiu-Jitsu lock called the Kimura.
The further out my elbows are, the weaker this is.
This is opposite to the mechanism of injury that occurs with forced external rotation of the shoulder, such as with an Americana. Dr. Stephen Cutts writes in Annals of Royal College of Surgeons, violent external rotation in abduction levers the head of the humerus out of the glenoid socket, avulsing anterior bony and soft tissue structures in the process, the Bankart lesion. As the final posterior part of the humeral head exits the joint, it often collides with the anterior rim of the glenoid, creating a bony indentation at the back of the humeral head, the Hill-Sachs lesion.
Oh, side control from Mir! Look at this! Kimura to Frank Mir! Can he get the submission?
When a skilled practitioner subdues your arm in the type of lock demonstrated by Murdoch, you'll roll forward to take the pressure off your shoulder, or tap. Otherwise, your shoulder or arm are toast. Obviously, Professor Murdoch's opponent chose the front flip escape technique. Of course, with the little bones of his pointer finger caught precariously inside his sidearm's trigger guard, he'd be even more inclined to escape the lock. And then, in classic Daredevil fashion, he is nearly incapacitated with a swift thump to what appears to be the left brow ridge, a nodule or crest of bone situated on the frontal bone of the skull. You'd think it clear by now that Professor Murdoch has these guys outmatched in CQC, and that he doesn't intend to kill anyone. They could just, stay down. This string of attacks is a masterclass in areas of the body that are especially susceptible to blunt force trauma. The posterior aspect of the neck, up towards the base of the skull, is home to the upper cervical vertebrae, which house and protect the most vital portion of the spinal cord as it extends from the brain down through the spine. A blow here is especially dangerous, as it can damage these structures, leading to spinal cord injury, which, when severe, paralyzes everything below it. Worse yet, an injury above the C3 level could damage the phrenic nerves located at the C3, C4, and C5, which provide motor innervation to the diaphragm and enable you to breathe. Really lends new meaning to the expression, Do I really need to explain this one? The only confusing thing is that he looks relatively unfazed after sustaining what appears to be a blow to the family jewels. Did you know that a strike delivered at a slight downward angle directly to the clavicle or collarbone can break it? Or that the collarbone is one of the most commonly broken bones in the body? However, fractures that occur here are most commonly associated with a fall onto the lateral shoulder, which transfers compressive force onto the bone from the lateral aspect. The NIH tells us a direct blow to the clavicle or a fall on an outstretched hand are less common mechanisms of injury. So maybe this guy got off lucky. I wonder who's next. Any clean connection would cause a fracture to the bones of the face. In this barrage, Professor Murdoch targets the patient's zygomaxillary complex, which is composed of the zygomatic, or cheekbones, and the maxilla, which forms your upper jaw. The last blow, which sends Matt's opponent sprawling into the adjacent room, poses the most threat to the zygomaxillary complex, and unfortunately, if a fracture occurs here, he will likely find himself in an operating room. A 2021 review of the literature conducted by Dr. Travis T. Tolfson reveals that 77 to 94% of patients with zygomatical maxillary complex, or ZMC fractures, require surgical reduction. All right, Professor, whenever you're ready. Ah yes, dodging like only you can. An excellent reminder that the best way to avoid injury is not to get hit. As per our patients, that sequence showed nothing we haven't seen already. What about something pertaining to the mandible? Ding, ding, ding. Here's what stood out to me there. The first uppercut is delivered with enough force to send the attacker's head snapping backwards. The jawbone or mandible extends from your chin to behind your ear. And despite the fact that it is the strongest and largest bone in the face, blunt force trauma along its width can cause fracture or dislocation. When contact is made from below, a fracture may be more likely to occur, as there are structures above the mandible that brace it against the sustained impact, causing the force of the blow to be translated through it. The condyles at the back upper edges of the mandible jamming into the temporomandibular joint, for example. This second straight left cross connects with the right side of the attacker's face and would create a horizontal or rotational force that would place more stress on the joint capsule, potentiating a dislocation. University of Pennsylvania Medical School tells us the standard treatment for acute TMG dislocation is reduction of the mandible, a technique by which the dislocated jaw is pushed downward and backward into its normal position. TMJ reduction frequently takes place in emergency rooms under sedation or general anesthesia. And that's probably because it's not too pleasant to experience. Those with a broken jaw, as may be present in a patient who has sustained a brutal kick to the face, won't get off so easily, as surgery is often required here when a fracture is present. In some cases, the jaw is wired to teeth of the opposite jaw to keep it stable while healing. These wires are usually left in place for 6 to 8 weeks and then replaced by small elastics which continue to hold the teeth together. Okay, interns, now that we've been acquainted with some common facial injuries associated with blunt force trauma, can you tell me what you might expect from this? Or this? Best answer gets a shout out at the end of my next video. Extra points if you can tell me why these 2 punches are so devastating. I don't see any hands out there. Well, if you'll recall earlier on, I mentioned that abdominal organs really don't fare well under blunt force trauma. The liver, which is located on the upper right-hand portion of the abdominal cavity beneath the diaphragm and on top of the stomach, is especially susceptible. A blow here can cause excruciating pain and will incapacitate a person almost instantly. Dr. Yu Xiao wrote in a 2013 study on liver injury that a lateral impact was most likely to cause liver injury, with a minimum punch speed of 5 meters per second. For reference, an untrained human can throw a punch as fast as 7 meters per second, but we're talking about Daredevil here, so. A punch to this region may result in a lacerated liver by penetration of fractured ribs. However, liver ruptures without rib cage fractures were found in autopsies in a series of cases. This organ, which is the largest solid organ in the body, plays a vital role in the body, processing blood and breaking down the nutrients and chemicals that it carries. It is innervated by both the sympathetic and parasympathetic nerve systems, but it is relatively unprotected as it peeks out from underneath the rib cage. When struck, blood pressure may be disrupted and the local nerves shocked, rendering a patient unable to get up, even though their friend could use a little bit of help. And just like that, we've all gained a little more knowledge about human anatomy. Special thanks for Professor Matt Murdock, or Daredevil, as he is known in Hell's Kitchen. Remember to check out my online gym, Human 2.0 Fitness, for free, right here on YouTube, where we help you prevent injury and move better. If you liked the video, be sure to give it a thumbs up and subscribe to the channel. If you didn't, be sure to let me know why in the comment section down below. And as always, that's been a word from Dr. Chris, not your everyday ortho, where we see one, do one, teach one.